Okay, it's Dr. Wolfe here. Let's talk a little bit about cardiac arrest, okay? Now, you've heard me talk about cardiac arrest before, either on my social media, I've mentioned it here on the podcast. But it is a somewhat controversial topic, and it's something I would have never thought would be controversial when I came out of medical school many years ago. However, when you say this thing, when you say those two words online, you will get angry people. So you will get angry people who are in healthcare, who have a different perspective than forensic pathologists have with the words cardiac arrest. And then you'll also have people who are not in healthcare, but they think they understand what the term means just based on their, I guess, experiences through life or in their community. And the truth is, none of us are actually wrong when it comes to that term. And the reason why is because we all have different definitions of what we're trying to say. So let me first start with general public or general usage of the term cardiac arrest. Now, I want to start with this one because this is the first thing that I knew growing up was when you would hear the term cardiac arrest, you would hear that in the town. You would hear, old Johnny Stevens over on Maple Street, he had a cardiac arrest and died. And everyone understood what that meant. Okay, that meant he probably had some kind of heart-related illness and died. So the truth is, it's not horribly incorrect usage there, but the problem is the reality of that situation is that old Johnny Stevens may have clutched his chest and died, or old Johnny Stevens may have been found dead in his bedroom, but the evidence that it was actually heart-related is essentially zero. Because, in these small counties like the one I grew up in, they hardly ever do autopsies. And I think these days they do a few more, but back then, coroner might walk in, look at the body, and see, okay, there's no gunshot wounds and there's no stab wounds, and this guy's 70 years old, so we're just going to call it cardiac arrest. So the problem is that, again, that is not a proper medical usage, and it is really words that are being used without evidence. So I can guarantee you all across the United States, people have said cardiac arrest to refer to kind of like a non-suspicious death that probably has heart in origin as its actual cause of death. And again, statistically, heart disease is the most common cause of death in the country. However, there are all sorts of things that can cause death that arise in the chest or even in the abdomen that can look like a cardiac arrest. So for instance, a pulmonary embolism is a large blood clot in the pulmonary arterial system, which blocks the ability of blood to flow from the heart to the lungs, and therefore you immediately stop oxygenating your blood, which then can cause cardiorespiratory arrest. So you would suffer a cardiac arrest in that situation, but the cause is not intrinsic to the heart itself. So general usage is kind of like the public saying, okay, it's probably a heart-related death. That's really all it comes down to. But of course, there are problems with that, as I said. I mean, if you find a person dead in their bed, it could very well just as be as likely to be like a cerebral aneurysm, or perhaps even something more nefarious like a poisoning. Now, let's move to a different perspective, which is the perspective of a healthcare worker. So the classic situation is a person is brought in either already in cardiopulmonary arrest, or they come in talking or perhaps talking about chest pain or things like that, and then they collapse and die. Well, the issue is that a lot of times when a physician writes the death note, so when a patient is in the hospital and they die, there should be a death summary from the physician. And a lot of times they'll write cause of death, cardiac arrest, or cardiorespiratory arrest, or cardiopulmonary arrest. All of those basically mean the heart and the lungs stop, but I don't really know why. Okay, so when a physician says that, and they don't have any other modifiers there, they are essentially saying the body died and I don't know why. It's probably a heart-lung related issue. And again, there's a lot of leeway there. There's a lot of imprecise kind of language there. And that's where death certificates are problematic, because you should never write cardiac arrest or cardiopulmonary arrest on a death certificate, because it is not an actual cause of death. So a cause of death is like the physiologic or anatomical aberration that leads to the death. So it starts the chain of events. Let me give you an example. So if you have an aortic dissection and blood is pouring out of your aorta into your left pleural cavity, your overall blood pressure is going to decrease second by second as that blood is pouring out into your left pleural cavity. So as that blood is pouring out, your heart is struggling to get more blood back from the lungs because it's no longer in the vascular system, and eventually you go into a terminal arrhythmia and die. So that is a situation where, yes, cardiac arrest did occur, but the source of the pathology was actually in the aorta. Let's do an example that's a little more dramatic and shows you how this term can be used inappropriately. If, let's say, your leg gets amputated accidentally, let's say you are a person in the woods, you've got a chainsaw, you are chopping trees down, and you accidentally, somehow the chainsaw goes into your leg and partially amputates your leg, and then each time your heart beats, the blood shoots not into your vascular system, but out of your vascular system onto the ground, and it keeps going lower and lower and lower until, once again, you go into cardiac arrest. So cardiac arrest is not the cause there. Sharp force trauma due to chainsaw injury is the cause, because that's what started the chain of events. And so more precisely with what I'm saying here is that cardiac arrest is a state of being. It is the end point of essentially all human disease, okay? So whether you have a diabetic ketoacidosis, or you have end-stage pancreatic cancer, or you have a cerebral aneurysm, or you have a heart attack, eventually your heart and lungs are going to stop functioning, and that is the arrest or the stoppage of heart and lung function, which is the last step in death. So what it is it is a very non-specific term. Essentially every single death has its last step as cardiac arrest. Now, I have said that before in videos, and then I always have a couple of people who say, oh, well, there was a study from Johns Hopkins that showed that the brain has electrical activity 4 minutes after the heart stops, and therefore the brain is the last thing to go. It's brain arrest, not cardiac arrest. And this is essentially an academic pursuit. It is a worthless consideration, because the only way to know if a person is having brain activity is to have them hooked up to an electroencephalogram at the time of death. So this is more of an academic thing of, how active is the brain, after the heart stops. From a physiological perspective, cardiopulmonary arrest or stoppage of the heart and lungs is the endpoint of all death, and therefore we have to be more specific. So now I enter to you the perspective of the forensic pathologist / medical examiner. Okay, so our job, our sole job, is to come up with the cause of death and the manner of death. So again, I tell you, the cause of death is the anatomical or physiological aberration that starts the chain of events that leads to death. The manner of death is the category in which that physiological aberration belongs. So for instance, if you are in a car accident and you have a horrible blunt force trauma, the cause of death is going to be blunt force trauma. The manner of death is going to be accident. And then the mechanism of death is going to be like exsanguination of blood, the last step of which is the stoppage of the heart, the cardiac arrest. So it's not that forensic folks get irritated when we see that in medical records. We just know that it's non-specific, and that the irritation comes when death certificates are signed out as cardiopulmonary arrest without any explanation as to why or how that arrest occurred. Because, those death certificates come through the health department, and medical examiners have to certify those, or coroners have to certify those death certificates as accurate, and those aren't really accurate. And now this is the part where healthcare workers slash other physicians sort of get chippy with people like me, because they say, well, what do you want me to do? Guess? I don't have any idea. Well, no, actually, I don't want you to guess, but it would probably be better to say something like cardiopulmonary arrest of undetermined nature or undetermined etiology or something like that. If you feel like it is a heart-related issue clinically or a lung-related issue clinically, then say that. Say cardiopulmonary arrest favor myocardial infarction, because you're basing that on cardiac enzymes, you're basing that on symptomatology, you're basing that on EKG. Let's say you have a case where a guy comes in intense chest pain, and believe me, I've had a number of these this year, by the way, where they come in with intense chest pain and their cardiac markers are not necessarily problematic. Their EKG doesn't look too bad other than tachycardia, and then they cold die. And then I do the autopsy and I find that they had an aortic dissection. That's why I seem to be talking about aortic dissections a lot lately, because I feel like I'm seeing one a week every time I go to work now. And that is a situation where if you're a physician and you have a guy with intense chest pain, but normal cardiac markers and normal EKG, you might say something like cardiopulmonary arrest favor aortic dissection. Now, that's pretty tough to diagnose without an autopsy, without a CT scan of the chest showing that dissection. So I understand that we're in a little bit of a quagmire here, because the physician in some cases, they do not have the full information. I mean, this is a person who's maybe had chest pain for 2 days and they're rushed to the ER obtunded, and they just have to take a guess at what happened. And on the flip side of that, the medical examiner or coroner system doesn't always take those as autopsy cases, particularly if they're older folks. If they're 70, 80, 90, those are almost never going to be autopsied. If they're younger folks, 40, 30, something like that, they're going to be autopsied. So we sometimes do have to guess, and unfortunately, death certification does have some imprecision in it because there is some guesswork involved. Now, if I had to add something to the way that we certify death, I would actually change the system. And I know this is a little controversial, but I would have it to where you wouldn't necessarily have to pin a cause of death super specific if you didn't autopsy, if you did not autopsy. And basically, what you would certify those deaths as would be like natural death, most likely cardiac, or natural death not otherwise specified. Because again, an 80-year-old can develop chest pain and get an aortic dissection or a pulmonary embolism, but there's really no way we're going to find out unless we autopsy. So I would much rather see death certificates divided into, death statistics divided into cases that we do autopsy with a definitive cause of death, and the number of cases that we have that we do not autopsy, but we are clinically a little bit uncertain. And then also ones that we don't autopsy in which we are clinically certain. So for instance, if you have a person who, let's say they're at home, they grab their head, they say, this is the worst headache I've ever had. You call the ambulance comes, they're still talking, they go completely unresponsive in the ambulance, they get to the ER, you get them back for a few minutes, you're able to get them in a CT scanner, you find that they in fact had a ruptured berry aneurysm, a subarachnoid hemorrhage, and they die. You don't need an autopsy there. You can easily certify that cause of death as, ruptured berry aneurysm, secondary to hypertension or something like that. So, I don't know if my dream of having those statistics, reported like that will ever come true. But I really do think that there's a big difference between the ones that we don't autopsy and the ones that we do. And in some ways, I feel like our cardiac numbers, which I can assure you are high correctly, but are they accurate? Because I think in a lot of areas of this country, there are people who say cardiac arrest, therefore it's heart, therefore we're writing this as atherosclerotic cardiovascular disease because we know the guy had hyperlipidemia or whatever. that's really not going to be accurate. It might be accurate, but it might not be accurate. And so it's a little bit frustrating to me because I feel like in a perfect world, I would have accurate death certificates, death statistics rather. Well, actually both would have to be accurate. But the only way that you could possibly do that is if you either autopsy every person that dies, or you will give an MRI or a CT scan or something to every person that dies. We simply don't have the resources for it. We don't have certainly the budget money for any of that stuff that I just mentioned. We don't have enough forensic pathologists, and we don't have enough radiologists, CT and MRI scanners to do that. Now in the future, probably long after I've retired, I think we will get more accurate death statistics. And, the reason why that's important is it helps you understand how your population is dying and what changes you might need to make in your population in the way that we, construct, treatment algorithms, or in the way that we construct like the food pyramid, so to speak. It may be relevant to that. Now, lastly, I just want to add one more point, and this is in reference to cardiac arrest. And I'm going to kind of read between the lines a little bit here and show you why this has become a little bit more of a hot button issue over the last 4 years. So COVID infections most certainly cause a lot of sudden death, okay? You have increased rates of stroke, increased rates of myocardial infarction, increased rates of pulmonary emboli, and all of those things can result in sudden cardiac death. So that has been a hot button thing where we've seen that big spike in 2020. So we know it's not vaccine related, for instance. But then in early 2021, you had a lot of people sort of blaming sudden deaths on the vaccine, which of course you can rule out those numbers because in 2020, when there was no vaccine, we had massive increases in death. In my practice alone, we had an 800% increase. I'm going to say that again. An 800% increase in strokes, pulmonary emboli, and heart attacks. And those are occlusive events in the vascular system. Okay, so in other words, what happens is the viral infection happens, you get damage to the blood vessel, and then when you have damage to a blood vessel, you have a repair process. Well, the problem is that repair process can go a little bit haywire and cause clotting, which then results in all those things that I just mentioned. But what happened is with that sort of anti-vax movement, what you had is you had a lot of media, and I hate blaming media on stuff. It's such a cop-out to be like the media did this, they did that. But the media makes money from clicks, from you watching and reading articles, from you being exposed to advertisements, etc. So what they started to do a lot more in 2021 and beyond is when someone would die, whether it was a famous person, an athlete or something like that, they would have it in the headline, cardiac arrest, because they knew that that was a hot button clickbait word, because you had people dying somewhat young suddenly, or sometimes they would even be old, and then that would cause a firestorm. People would share that article online and they would say, oh, look, this person died, and the title says cardiac arrest, which means it was a heart-lung issue caused by the vaccine. And then you would have a bunch of people who are scientists and people who are scientifically literate who would then argue in those comment sections and share those videos and say, no, it's not. This is the natural process of the COVID-19 virus. And so what happens is the truth in that situation doesn't actually matter to those media companies or certain people involved. It's that it generates a lot of revenue. You can imagine, people doing YouTube videos and TikTok videos where you get, $1,000 for every 500,000 views or something. They're going to say whatever they can. So I noticed that media outlets were putting cardiac arrest in the title of these articles so that when you would search for it in Google, it would come up, and then people would use that as quote unquote evidence of some sort of nefarious conspiracy. But then when you read the article, you found that the cardiac arrest was because they were in a boating accident. And then when they were brought to the hospital, the doctor signed it out as like cardiac arrest or something. And that's sort of a bad example. But there was a couple where it said sudden death. And then you would read the article and you would find out it was a car accident, or it was an accidental injury with a knife to their femoral artery or something like that. And there were deaths where it was a question mark, like, oh, well, what happened here? This was a youngish person who passed away, and it appears to be a cardiopulmonary issue. Could it be related to that? And so I think what happened, what I'm getting at, is that the media co-opted the term cardiac arrest, because when people are brought to the hospital, they are in an ambulance, and they are, EMTs will sometimes write, cardiac arrest in their reason for transport. And then that shows up in the ER records. It shows up in the medical records. And so when those are reviewed, that's what comes out. When the media grabs, somehow they get a hold of a record, it'll say cardiac arrest. And so then it just started to get used more and more and more. And there are unfortunate folks out there who, if anybody dies now, I mean, we're in 2024, we're getting closer to 2025. If anybody dies, it's automatically due to some sort of government cover-up / vaccine thing. And you really can't argue with those people in any rational way, because people died before 2020, and they certainly died before 2021, before any sort of vaccine. But now, anytime someone dies, it is related to those things, at least in their view. So it's resulted in a situation where the term has ownership by certain groups, and we all have different definitions for what we're trying to say. But the ultimate thing to do, the final thing with the term cardiac arrest is the takeaway is it's not a cause of death. A cardiac arrest can be due to heart-related issues or not due to heart-related issues. And when you hear the term cardiac arrest, this is for everybody listening. When you hear the term cardiac arrest, you have to ask the next question, which is, due to what? And the answer to that question is the cause of death. That is what started the chain of events that resulted in heart stoppage. And sometimes we don't have answers to those questions. Sometimes, in a very small percentage of cases, we do have a true cardiac arrest where a person is, let's say they're running, or they're just at home and they clutch their chest and they fall over. We do an autopsy, we do toxicology, we do genetic studies, and everything comes back negative. Those are the most frustrating cases in my career. I have about one per year where I simply cannot find any pathology that caused it. And also, that's very distressing to think that that sort of thing can happen. So I hope you are understanding what I'm saying here, in that this very simple two-word phrase has caused a lot of despair and a lot of misunderstanding among different groups of people. And we can't really have a rational discussion unless we are on the same footing, unless we are talking about the same thing. Do we share the same definition of what that term means? At any rate, if you have any questions, this wasn't really meant to be a sort of tutorial on how to fill out death certificates. I mean, young doctors sometimes don't know how to fill out death certificates, but I think I made my point that cardiac arrest is not a cause of death, and you should be more specific. The chain of events of what happened, such as myocardial infarction due to atherosclerotic cardiovascular disease due to diabetes mellitus, cause of death, manner of death natural. So, but yeah, this is not really meant to be a tutorial on that as much as it is to explain why a lot of us have difficulty in sharing information about that particular term. So if you have any questions, you can find me I'm on TikTok, I'm on Instagram. Those are both the Dead Letter. My YouTube is called Knife After Death. And, you can find my Substack, which is Dr. Darren Wolfe. My Substack is, I literally teach forensics over there, and I cover things like infectious disease, where I do kind of cases in the news that pop up, new diseases that pop up. But I do forensic posts. Some of them are paid, some of them are not paid. If they're very gruesome, usually those posts are for subscribers only, because I don't really want those photos like floating around on the internet. But if they're basic stuff, I usually leave them as free posts. So if you want to come over and subscribe, please do. And if you have any questions, just give me a message. Thank you.